Bismillahirrahmanirrahim. Quote of the day: the only way to do great work is to love what you do. If you haven't found it yet, keep looking, don't settle. Today, the topic of my presentation is ethical and professional issue in epidemiology. Learning outline of my presentation is ethics, ethical values in public health, ethical issues in epidemiology, privacy and confidentiality, guidelines of ethical issue in epidemiology, recent advances, and at the end, there is an MCQ session. At the end of this presentation, participants would be able to describe about ethical obligations that investigators have to people who volunteer to participate in epidemiological studies and recent updates. No man is an island entire of itself. Every man is a piece of continent as a part of the main. Any man's death diminish me because I am involved in mankind and therefore never sent to know for whom the bell tolls. It tolls for thee. Ethics, basically ethics is a Greek word meaning morality, manner, custom, and character. Ethics code of moral principle, and it set the standard of good and bad as opposed to right and wrong. There are some ethical behaviors like honesty, integrity, trustworthiness, fairness, kindness, respect, lawful, excellence, leadership, and responsible. There are some view of ethics which are given in the form of different theories. Utilitarian view of ethics, greatest good to the greatest number of people. Individualism view of ethics, primary commitment is to one long-term self-interest. Moral right view of ethics, respect and protect the fundamental right of all people. And the justice view of ethics, give the fair and impartial treatment of people according to legal rule and standard. There are two approaches have figured out most prominently, and the one is the principle-based approach to moral reasoning explicated by Buchip and Childress, and the second one is case-based methods such as casuistry. And these are the now we discuss the principle based approach, and the first basic principle based approach in the value of ethics is the autonomy. And in the autonomy, there is the respect for research participants able to make independent choices and decision. Participant has right to make self decision, make self choice, withdraw from study, isolation when community at risk. Second one is non-maleficence, to do no harm, duty to avoid, prevent, or minimize the harm. Minimizing harm requires smallest number of subjects that will ensure valid data. And in the beneficence, there is any method of good which you can do to do good, the duty, fulfill your duty, benefit the others, maximize net benefits and contribute to national cost, and the maximum community contribution in the community work. In the justice, it is the synonym with fairness and equity. Treat participants fairly and equitably before and after the research study. Fourth one is veracity. It is basically a truthfulness and honesty, concept of truth about the research study and absence of deception. The principle of veracity is linked with respect for autonomy. And in the fidelity, there is also a concept of trust. A participant place trust on researcher, and this necessitates a commitment to protect them. A researcher must ensure that the participant have understanding of risk. And in the confidentiality, there is the duty of anyone entrusted with health information to keep that information private. and what are the methods from by which we maintain the confidentiality of a subject. Epidemiological studies have used following procedure to protect the confidentialities, like informed consent, data store under lock and key, de-identified data, destroy individual information at end, result published in group form, individual identifying information, and the importance of confidentiality. Case-based approach. While many journal ethical questions have been answered on the basis of journal principle and theories, but the specific decisions that emerge in a particular case may remain unaddressed by the principle. Such decisions are often made by focusing on the circumstances of the case at hand at the moral context in which the case rests. Case-based methods such as casuistry are grounded in analogical reasoning, appeal to paradigmatic cases, and practical judgment. A biopsychosocial model is one of the behavior model in which it basically helps the primary care doctors to understand interaction among biological and psychosocial component of illness to improve the dyadic relationship between clinicians and their patient and multidisciplinary approach in patient care. How does we differ the epidemiology from other scientific and medical disciplines with regard to ethical issues? So there are some guidelines for ethical issues in epidemiology given by the American College of Epidemiology. First one is, what are the professional role of epidemiologist? The professional role of epidemiology has its primary role the design and conduct of scientific research and the public health application of scientific knowledge. This includes the reporting of result to the scientific community, to research participant and to society, and the maintenance, enhancement, and promotion of health in communities. Second one is minimizing risk and protecting the welfare of research participants. Epidemiologists have ethical and professional obligation to minimize risk and to avoid causing harm to research participant and to the society. The risk of non-research public health practice activities also should be minimized. Third one is providing a benefit. Epidemiologists should ensure that the potential benefit of studies to research participant and to society are maximized by, for example, communicating result in a timely fashion. Steps should also be taken to maximize the potential benefit of public health practice activities. Fourth one is ensuring an equitable distribution of risk and benefit. Epidemiologists should ensure that the potential benefit and burden of epidemiological research and public health practice activities are distributed in an equitable fashion. Protecting confidentiality and privacy. Should take appropriate measures to protect the privacy of individual and to keep confident all information about individual research participant during and after a study. This duty also apply the personal information about individuals in public health activities. Obtaining the informed consent of participant. Epidemiologists should obtain the prior informed consent of research participant with exception noted below in part by disclosing those facts and any information that patient or other individual usually consider important in deciding whether or not to participate in the research. Submitting proposal studies for ethical review. Epidemiologists should submit research protocol for review by an independent ethics committee. An exception may be justified when epidemiologists investigate outbreak of acute communicable disease, evaluate program, and conduct routine disease surveillance as a part of public health practice activities. Maintaining public trust. To promote and preserve public trust, epidemiologists should adhere to the highest ethical and scientific standards and follow relevant law and regulation concerning the conduct of these activities, including the protection of human research participant and confidentiality protection. Avoiding conflict of interest and partiality. Epidemiologists should avoid conflict of interest and be objective. They should maintain honesty and impartiality in the design, conduct, interpretation, and reporting of research. Communicating ethical requirements. Epidemiologists should provide training and education in ethics to the student of the discipline as well as to practicing scientists. They should demonstrate appropriate ethical conduct to colleagues and students by example. Obligation to communities. Epidemiologists should meet their obligation to communities by undertaking public health research and practice activities that address health problems, including questions concerning the utilization of healthcare resources and by reporting result in an appropriate fashion. This is the example of how we use of record linkage in occupational studies. In occupational cohort, there are we expose different interviews of subject, industry MD record, private MD record, hospital record, and a death certificate, and we gather all these information, and by the help of these information we identify cases and then we calculate incidence or mortality. Now it's time for the recent updates. There is an article in which they discuss the ethical challenges and moral distress among field epidemiologists. Our disease detectives and director of public health program, field epidemiologists play essential role in protecting public health. Although ethical issues receive considerable attention in medical and research settings, little is known about moral distress among field epidemiologists. Moral distress is strongly associated with empathy fatigue, burnout, reduced job retention, and disengagement. To better understand ethics training needs for field epidemiologists, in February 2019, member of TEPIC Connect, an online and mobile networking platform for field epidemiological training program alumni, where they invited to participate in an anonymous survey about ethical challenges and moral distress. And the second one article in which they discuss the ethical issues in epidemiological studies, and in this they discuss about the and epidemiological studies involve the population, and as ethical issues are an important aspect of it which need to be properly understood and adhered to. These issues can relate to informed consent, appropriate sample size, selection of participant, confidentiality, conflict of interest. Attention to ethical issues can facilitate the effective planning, implementation, and growth of a variety of public health program and research activities. Moreover, with advancement in epidemiology like molecular epidemiology and genetic epidemiology, the ethical issues become more complicated and solved. Now it's time for the MCQs. The four medical ethical principle which shared between values based medicine and the principle of ethics explained by Bishop and Childress are autonomy, privacy, respect and confidentiality, veracity, privacy, beneficence, and non-maleficence, autonomy, non-maleficence, beneficence, and justice, veracity, privacy, confidentiality, and fidelity, and the last, autonomy, veracity, non-maleficence, and beneficence.
Sí.
C is the right answer, autonomy, non-maleficence, beneficence, and justice. Paternalism among doctors is not an ethical attitude because it conflicts with patient's medical care, doctor task and duties, patient's autonomy, doctor's autonomy, patient's family right.
E.
C, patient's autonomy. The standard of healthcare known as reasonable professional is defined by practice, standard, education, institutional policies, federal and state status, federal law, state law, county ordinance, city ordinance, competency, education, experience and success, coursework, internship, practical and experience, internship, practice and experience.
A.
A is the right answer. Practice, standard, education, institutional policy, federal and state statutes. Fair distribution limits over duties of beneficence. What basic good of others should be met before we dole out any luxuries? Food, kindness, education, attention, compassion, consideration, a job, home and education, nourishment, shelter, clothing, food, entertainment, and championship.
B.
D is the right answer, nourishment, shelter, clothing. According to the ethical principle, the benefits we are obliged to provide as healthcare professional are specified in part by over upbringing and personal values, over relationship, role and agreement, over employer, the law or conscious, over contract with the hospital or clinic, over willingness to help.
B.
B is the right answer, over relationship, role and agreement. The classification of patient as intellectually subnormal or confused may put ethical consideration on. They can never be guilty of negligence, their ability to give informed consent, their autonomy. Healthcare workers are sometimes cruel. They can never give informed consent.
B.
B is the right answer, their ability to give informed consent. XYZ patient diagnosed as a case of cancer, and what is the criteria when the confidentiality of this patient be breached? When the patient does not listen to the doctor, when financial resources are scarce and patient is not compliant, when a patient authorized to do so, for a patient who require invasive treatment, in the case foreign nationals in a country.
C.
C
C.
is the right answer, when a patient authorized to do so. In a behavior sciences, the biopsychosocial model of healthcare is best described as the management of psychological and social issues of patient, biological aspect of disease being more important than a psychosocial aspect, use of social and psychological factor alongside the biological aspect of the illness, a method in which a patient should be seen, physiologist and a social worker, a system practiced mostly in the developed world.
A.
C. C.
C is the right answer, use of social and psychological factor alongside the biological aspect of the illness. The most important consideration regarding the information in informed consent is it be understood by the patient, it must be communicated free of emotion, it must be technically accurate, it must be delivering in writing, it must be strictly medical.
A.
A is the right answer, it be understood by the patient. The ethical principle don't approve restriction, put or guide what information must be shared in obtaining informed consent. Because physician may not favor an expensive treatment. Physicians are always changing their custom. Patient have right to know all the detail of their illness management and possible outcome. Patients are too likely to simply agree without thinking. Patient mistrust physician, creating a conflict.
C.
C is the right answer. Patient have right to know all the detail of their illness management and possible outcome. These are the key of my MCQs, and thank you.
Thank you very much, Dr. Naila. Would you please stop the recording so that we can have a better discussion about today's presentation?
Yes, ma'am.
Stop recording.